U.S. Surgeon General Dr. Jerome Adams is a member of the White House Coronavirus Task Force, and he joins us from Washington. Dr. Adams, good morning to you. Thank you for being here.
Good morning.
On this program on Monday, you warned Americans that it was going to be a bad week, and that proved to be true. There was nearly a tenfold increase in the number of official cases of coronavirus. Can you say now on Friday that the worst is still yet to come?
Well, it's important for people to know that everyone's curve is going to be different. New York is going to look different than Boise, Idaho, or Jackson, Mississippi, or New Orleans. And we know that this week was a particularly bad week for New York. The good news is that China, South Korea are reopening. Italy looks like deaths and cases are going down. And in Washington, and you heard the governor of New York actually say yesterday that their cases have actually leveled off in terms of new cases day by day. So we know that we can get through this.
Definitely we can get through this. But Dr. Adams, as a country, should Americans gird themselves for what's ahead? Is the worst of this still ahead of us?
Well, again, it depends on where you are. We're hopeful that next week New York will start to come down because, again, their cases have started to level off. And that's because they've been aggressive about their mitigation efforts. We see that now the places that have been aggressive about staying at home, about keeping under groups of 10 have been successful. But we also see hot spots like Detroit, like Chicago, like New Orleans that will have a worse week next week than what they had this week. So again, as Tony Fauci said, the virus and the local community are going to determine the timeline. It's not going to be us from Washington, D.C. People need to follow their data. They need to make the right decisions based on what their data is telling them. And the good news here is that we've seen testing increase significantly. We're approaching 1 million tests. We're trying to give people the data so that they can make informed decisions about where they are on their timeline and what they should be doing.
Dr. Adams, let's talk about ventilators for just a second. You know, doctors and nurses around the country are saying, hello, government, we need ventilators now. But President Trump seems to have a different take on that. I want you to hear what he said last night and get your response to that.
But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators. You know, you go into major hospitals sometimes, they'll have 2 ventilators. And now all of a sudden they're saying, can we order 30,000 ventilators?
Dr. Adams, the president, to our knowledge, has no medical training, yet he continues to question the advice from the medical experts and professionals. Is that frustrating to you?
Well, you mentioned ventilators, and Dr. Birx said this. When you look at some of the projections out there, they're based on worst-case scenarios and doing something. I heard a reporter yelling at Peter Navarro yesterday, where is 1 million ventilators? 1 million ventilators for the United States would mean 1 in 300 people in this country were on a ventilator at once. There is nowhere in the world where we've seen that type of spread of coronavirus. Not even close. And so some of these projections are way off, but we are leaning into supply. I was on a meeting with the American Society of Anesthesiologists last week, and they've identified 70,000 ventilators that are in communities right now
but
that can be converted.
But we heard New York Governor Andrew Cuomo ask for ventilators. He gave very specific numbers. Do you think he doesn't know what he's talking about when it comes to this issue? When he's in constant contact with New York, the top New York hospitals, by the way.
Well, I think that I think that's a fair question, and I think that if you talk to experts, Dr. Fauci, Dr. Birx, and others, the models in many cases are way off. New York City, we actually have people on the ground who have told us that there are 1,000 ventilators sitting in a warehouse right now that haven't been used. You heard Governor Cuomo yesterday say, look, we actually have resources, they're just mismatched. And so we sent a team, a FEMA team, to help New York City make sure the resources are getting to where they need. I talked to people in Western New York who said they're furloughing nurses and hospitals in Western New York State, and while people in New York City are suffering. We need to make sure we get the right resources to the right people, and that's what we're committed to doing.
So are you pleased with the government's response, Dr. Adams, based on what you're saying to us right now? Are you pleased with how things are going?
Well, pleased is, I don't think, a fair word because, gosh, there are people dying. My colleagues out there are suffering. I'm not pleased with the entirety of the response because it takes state and federal and local people coming together.
Take out pleased. Are you satisfied?
Pardon?
Are you satisfied with how things are going?
I'm not going to be satisfied until we get to the end of this and we see cooperation at every level and we see healthcare workers getting what they need.
Dr. Adams, you mentioned hotspots, and at the same time, the administration is putting out a letter to governors saying they may have tiers for risk. Different areas of the country would open, others would not. Given the lack of testing in many areas, and given that one patient moving from one hotspot to a non-hotspot can ignite a whole new outbreak, how realistic is it really to have those tiers? How are you going to do that? Are there going to be bans on movement?
Well, you heard Dr. Birx say yesterday that 19 out of our 50 states, about 40% of the population of our country, has been doing surveillance testing and has shown consistently low rates of spread of coronavirus. We also know that the local authorities are the ones who make those decisions. I used to run a state health department for 3 years. We want to give people the tools they need to make the right decisions. And right now, there are some places that are going to be New York City. There are other places that are going to see low spread, and we want them to have the information to make the right decisions. And we're not going to make those decisions from D.C. We're going to give them the tools, the advice, the data, and it's going to be up to them to decide what they do.
Thank you very much, Dr. Adams, for being with us.